Dr. Manchanda, if you could tell us about your current projects.
See, Dr. Lal PathLab, as you know, it's in diagnostic field. So we are one of the largest pathology and provider in India. We have close to 160 labs and 2,000 collection centers. We pick up samples from about 6,000 pickup points. We are servicing about 10 million patients every year. Our model is hub and spoke model, so we keep opening a lot of satellite labs. We keep opening a lot of collection centers. So currently we are expanding to eastern part of India. We have one big central lab in Delhi. So we plan to open another big central lab in Calcutta. We've just started work there, so it will be over in about 1.5 years. So that way we are just expanding our geography both in northern part of India, eastern part of India, then we go down south, down west. So the key project for us is just to keep expanding geographically.
You've been in the industry for more than a decade now. So how do you think we can bridge the gap between the rural and the urban
Yeah, I think
ecosystem?
it's a key point that is being discussed virtually in every forum where I go. That healthcare has become very expensive. It is not accessible. Uh, Mostly what gets talked about is that yes, at the top end of the pyramid, people have access to healthcare, but as you go down the pop strata, accessibility is a big issue. Uh, Medical manpower is not available, so nobody actually wants to go and settle down in villages and work in that area. Uh, I think the way it is getting bridged, that's the theme of today's conference as well, is that can healthcare become smarter? And I think technology and IT are going to play a big role in that. Remote healthcare stroke telemedicine is going to become way of life going forward. Of course, there are certain regulatory issues around this, but I think if there is a need, uh, solution will automatically come out. We have had a lot of supply side constraints that we don't have manpower, we don't have infrastructure. All this requires huge investments. My sense is that some of the enablers like IT and technology will really help us to provide access to people down the pop strata.
What would be the extent of leveraging technology, cloud and analytics in order to help the marginalized communities?
I think it's going to be a very exciting and fascinating journey as I see for healthcare, because this morning we saw how WhatsApp is being used by a villager to really connect with the doctor in urban areas. Now WhatsApp and then so many mobile phones in the hands of people, it's actually just going to connect people with people in urban India. So so I think that's what is going to happen.
Right. By 2028, we would be the most populous country in the world. Do you think healthcare for all is possible? And also, what's your opinion on the Swachh Bharat Sabka Vikas?
I think we still have a long way to go. So I am not very sure whether by then universal healthcare can be achieved. But definitely, it will be much better than where we are sitting today. Directionally, it is going to improve. On the Swachh Bharat, my view is the following. I think it's a great initiative because a country like India has a huge burden of communicable diseases. A simple hygiene and sanitation issues, if you are able to address, and we don't need to talk about all this what we are talking about, and the disease or infection load itself will come down. So I think it's a great initiative. It will help a country like India.
All right. Dr. Manchanda, with the FDI open in healthcare now, any competition?
Not really, and especially in our diagnostic space, it is not really a challenge of investments. It may be for hospital side. Especially the industry or space which I work, we don't require large investments. We are not heavy capex sort of a oriented space. For us, the real challenge is execution challenge, the management challenge.
So, do you think FDI has helped your sector?
Yeah, see, we have already have some private investments, so that really has helped us because you invest, you scale up, you go to virtually every nook and corner of the country, so it is going to help. Investments are always welcome.
All right. Anything you would like to add?
Yeah, what I would like to say is that basically people really have to get more aware about healthcare. They need to take charge of their healthcare. it's early diagnosis which is more important, which is causing all the problems. Because if you diagnose a problem a little later, then the expense is also very high, the chances of survival very low. So if you have a preventive healthcare mindset and lifestyle changes you bring in your life will always help us to manage our healthcare better. That's the only message I have for everyone.
All right. Is there any current corporate social responsibility in healthcare by your organization?
Yes, we have been mandated by the law now to provide 2% of our net profit towards CSR. As I mentioned in my panel discussion also, that as a CEO of my own organization, I've started working on it. We've created a trust where we have already put money in that, so we want to put together a plan. There's a little bit of clarity which is required whether a company like us can do CSR in healthcare or not, or do we need to do in some other areas. So we're just trying to figure that out, and once the clarity emerges, we'll certainly put together an action plan. But I'm committed to doing CSR work from my own organization.
Just one last question here. Few do's and don'ts for startups who intend to come to this sector or start up a business in the healthcare sector.
Yeah, what I'm seeing is that there are two kinds of entrepreneurs who are coming into this space. There is a medical side, there's a clinical side of healthcare, which is highly technical. It is not, everybody doesn't know about it. Then there is a service side of healthcare, which is where a lot of these technological startups are really, they are coming into this area. So they need to integrate with the medical world very well. And I think just connecting all the stakeholders and connecting the dots is very key. So my input to the startup company will be that you need to have in your team a medical talent which can guide you in the right direction. Otherwise, you may fumble on the way.
All right. And don'ts?
Don'ts are that medical, it's not like any other ventures where some of these guys are going after valuations, and medical innovations, disruptions do happen, but it takes time. I've seen gestation periods in medical world is much longer than what I've seen in other domains. So have patience.